Hello, welcome to Eva's Care, that of health. I'm your nurse, Eva Maria. On today's episode, we are going to talk about sickle cell disease. What is sickle cell? How do we get sickle cell? All about sickle cell disease. Stay tuned and you will be well conversant with the disease. Sickle cell disease is an inherited group of disorders that causes the red blood cells to mishappen and then break down. Normally, red blood cells take 120 days to break down or to get replaced. But in sickle cell disease, they take 10 to 20 days to break down. And this causes a shortage of red blood cells. Red blood cells transport oxygen throughout the body. And if they are sickle-shaped, and if they break down, and we get an insufficiency of red blood cells, this also causes an insufficiency of oxygen levels in the body. Sickle cell disease derives its name from the sickle-shaped red blood cells that are formed. The red blood cells are usually round and flexible. They easily move through the blood vessels. But in sickle cell disease, they tend to get a sickle shape, or you can call it a crescent shape, like a crescent moon. And this makes it hard for the red blood cells to move through the narrow blood vessels. How do we get sickle cell disease? As I said earlier, it is inherited. We have three types of people. We have the sicklers, and these carry the SS. You can call them the SS. We have people who are called carriers, and these are the AS. You can call them carriers. They live with the traits of sickle cell disease. And we have the normal people. These carry the AA, and these are those people that don't have any trace of sickle cell. So, if someone is to get sickle cell, it is an inborn. You're born with it. It is not communicable. You are born with sickle cell disease, and being born with sickle cell disease means both your parents were carriers. So, if two partners decide to have a baby, and these two partners are carriers, chances are high that they are going to give birth to a sickler, to a baby who will live with sickle cell disease. And if a spouse who is a carrier gets a partner who is not a carrier, they may get carriers, but they have no chance of giving birth to a sickler. So, this is the main reason as to why we encourage couples intending to get married or partners intending to make a baby to go for counseling, to go for testing. They screen for sickle cell, and this will help identify if you're both carriers, or if one of you is a sickler and the other is a carrier, or both of you are non-carriers, so that we know the way forward, so that we don't fall trap into this. How do we know that this person is having sickle cell disease? Normally, the disease manifests at the age of 6 months. You're born with the disease, but you can live normally for the first few months of your life. And then after these very few months, like 5 to 6, you start getting symptoms. And these are the symptoms of sickle cell disease. The symptoms of sickle cell disease include anemia. As I explained earlier, the red blood cells break down before their term, and this causes a shortage of red blood cells that carry the heme, and this brings anemia. We have pain, and this pain is usually in the joints and other body parts too. So this pain is brought about by the sickle-shaped red blood cells that are trying to move through the narrow blood vessels, and most especially around the joints. This brings episodes of pain, and people with sickle cell disease tend to get severe episodes of pain, and these vary. The pain could take days or even hours, and it is too severe that sometimes it needs hospitalization to manage. We have frequency of infections because the body is not getting enough nutrients, because the oxygen levels are low, and because the body cannot stand the very many diseases. So this person ends up getting frequent infections. We also have swelling of the hands and the feet because the sickle-shaped red blood cells tend to block the flow of blood. This makes it hard for blood to flow to extremities, the hands and the feet, and this brings into the swelling. We have delayed growth and puberty because of the low oxygen levels, and remember, oxygen is sufficient and oxygen is needed in growth. So the person tends to get delayed growth and delayed puberty because they don't have enough oxygen levels to sustain their growth. And most of the people with sickle cell disease have stunted growth. They also tend to get vision problems. When do I seek medical attention? If at all I'm having sickle cell disease. A person living with sickle cell disease has to be under medical attention. There has to be a supervising medical personnel all the time. In case you get any symptom, you observe any changes, you have to report this directly to the medical personnel attending to you. However, if this person gets any signs of stroke, such as one-sided paralysis, you need to seek urgent medical attention. If this person gets confusion, if this person blacks out, if this person tends to get constant vision problems, you need to seek medical attention. Need to put our attention to this. Sickle cell disease can be prevented by me and you by doing the screening. That is the only way, the best way we can get rid of sickle cell disease. Let's combine efforts. Let's all do a screening. Make sure you don't get a marriage partner before screening them for sickle cell disease. Make sure you don't plan to have a baby with anyone before you take the screening, because you cannot tell a carrier just by eyesight. A carrier can only be identified through screening. So if at all we are to eradicate sickle cell disease, we need to take a step and do the testing. Testing is free of charge in hospitals. You can go to government hospitals, and even if it is chargeable, the charge is not high. But for government hospitals, it is free of charge, and these services are there with trusted medical personnel. Thank you for tuning in and keeping on Eva's Care. Don't forget to subscribe, share, like and follow on all our social media platforms. Until next time, bye-bye.